Managing oxygen therapy for a loved one can feel like a huge responsibility, but once you find a routine, this will become a seamless part of your day. Let's go through some technicalities so you can focus on your loved one's quality of life. There are generally two ways oxygen is delivered at home: home oxygen concentrators, or HOCs, and portable oxygen concentrators, or POCs. Both generate medical-grade oxygen by pulling in room air, filtering it, and delivering purified oxygen through a nasal cannula or mask. HOCs are larger, stationary concentrators that stay inside the home. They plug into the wall and deliver continuous flow oxygen therapy, best for home use, sleeping, and for people who need a higher flow of oxygen. Maintenance includes washing the intake filter weekly with warm water and letting it air dry completely to prevent bacterial growth. Pause here for HOC setup instructions. Be sure to check the user manual for instructions specific to your unit. Portable oxygen concentrators are small and lightweight, designed for travel and running errands. These units have batteries, or they can be plugged into a wall or vehicle. Most deliver pulse dose oxygen therapy, which means they deliver a dose of oxygen each time the user inhales. Different POCs have different battery lives, and it's often helpful to carry extra batteries and charging cords when out and about to ensure your loved one doesn't run out of power. Maintenance includes ensuring the exterior vents remain clean, checking the removable particle filter weekly, and replacing the sieve beds as recommended by the manufacturer. Pause here for some basic POC setup instructions. Be sure to check the user manual for instructions specific to your unit. When managing a loved one's oxygen therapy, having a daily checklist can help maintain the unit and reduce anxiety. Here are some steps you can take every morning. Inspect the nasal tubing for cracks, kinks, and water, replacing if necessary. Check that the flow rate matches the prescription. Check the patient's skin behind the ears and inside nostrils for soreness or redness. Water-based lubricants can help prevent skin irritation. Never use petroleum-based products near oxygen, as they are a fire hazard. Check water levels in the humidifier and refill with distilled water. Empty, wash, and dry the bottle every 1 to 3 days. Check oxygen tubing placement to ensure the tubing is clear of walking paths in the home and keep the tubing shorter than 50 feet. Here are some general safety protocols to keep in mind. Avoid open flames. No smoking or vaping within at least 10 feet of the equipment. Avoid extension cords or power strips. Instead, plug directly into the wall. Avoid grease, oils, oily lotions, and aerosol sprays. Plan for power outages by letting your power company know that the patient is using oxygen. They will generally prioritize that address during power outages. Also, keep backup e-tanks and batteries on hand. Oxygen concentrators are designed with safety alerts and alarms. Here are some common ones. Find details about the audible and visual alarms in the user manual, so you can prevent future panic and troubleshoot issues quickly. When people transition to oxygen therapy, they often feel a loss of freedom. Your goal is to help them see oxygen as a tool for activity rather than a device that keeps them tethered. Here's a quick list of things you can do to support your loved one and help them feel in control. Normalize the cannula. Many people feel self-conscious when they start wearing one. Remind them that oxygen is a tool to help them stay engaged and active. Work with them on breathing techniques to reduce the shortness of breath and anxiety cycle. Listen to them and validate their frustrations. Keep the POC travel ready, maintained, and batteries charged, so leaving the house doesn't feel like a hassle. Teach them how to self-monitor their blood oxygen levels with a pulse oximeter. They can learn when it's okay to stay active or if they need a break. Use longer oxygen tubing inside the home. 25 to 50-foot tubing can make it easier to move from room to room. Although all this can feel overwhelming at first, with practice, it'll become a daily routine that helps your loved one thrive. Take a look at our other videos for more tips on living with oxygen therapy. And if you have any questions, our oxygen experts are ready to help. When you breathe easier, we breathe easier.